Jeff and Wayne, on this interesting subject, I hope all you blokes out there are actually listening and tuned in.
Yes, well, we've been talking about BPH, or benign prostate hyperplasia, again that word. Let's talk now more about general dysfunction. What are some of the symptoms or causes of male sexual dysfunction, Wade?
Oh, well, Jeff, this is when we start to have some fun, mate. Yeah, this is a massive market, and it's filled with a lot of, well, rubbish that's aimed at men, or more so at kind of attacking men's confidence and performance in the bedroom.
You know that's true. It's $1 million industry with a lot of companies claiming to make things bigger and longer and harder, right?
Well, it is true. Not to mention all the emails so many of us always get. Look, to clarify though, when we're talking about general dysfunction, we aren't so much talking about infertility, which of course, Jan covered last week so well. But we're talking about one's inability to achieve successfully, sexual intercourse. Now, this could be plain old impotence, which is the inability to either obtain or maintain an erection, or the inability to orgasm or premature orgasm. It can even be what we call priapism, which is a very painful condition by which one stays erect.
I've never heard anyone complaining about that, mate. So what can be done about this?
Well, not specifically about the priapism, but about the general dysfunction. Look, again, there are mechanical reasons that need to be treated medically, or low testosterone levels. They certainly play a part in our sex drive and energy. But for a great deal of men out there, supplementing with vitamins and amino acids that increase blood flow to the area, relaxing the blood vessels, nourishing and increasing testicular function, improvements can be pretty quickly noticed, especially where impotence is the main issue. Now, please understand, Jeff, I'm not talking about just quick fix nasal technology. I'm all about balancing the whole body. A lot of men have high blood pressure, high cholesterol, they deal with stressful jobs, and these things really do impact on our ability to function sexually, because let's face it, while sex is fun and pleasurable, its primary role, and certainly the way the body sees it, is conception. And that's all our body really knows. It doesn't really realise that you want sex to last a certain amount of time, or that you need to please your partner. It just knows that you're worried sick about snaring that big contract tomorrow or finishing a report for work. Look, expecting it to relax and perform sexually in the middle of all this worry, it's just not how your body works. So if you want to live a lifestyle that's not suitable for conception, then good sex really, it's not optimal, it's not going to happen as well as it should. But these days, of course, we've come to expect that kind of control, and we presume a tablet or a spray can give it to us. So, presuming that you have no mechanical issues or nerve damage or whatnot, the idea is to look at what the whole body needs to cope with the lifestyle that's being lived, and what your diet is lacking in order to support these functions. On a purely mechanical level, we need to get blood to the area. We need to keep the blood there in order to have correct, or to correct impotence, I should say. So relaxing blood vessels with something like L-arginine or muscle relaxing herbs, increasing that blood flow with, say, cayenne pepper, or decreasing clotting with omega-3s, omega-3s I should say, and vitamin E, even taking into consideration arterial plaque. All of these things contribute to the amount of blood that's getting to the penis. And they also just happen to treat other health problems that I just mentioned before.
So you're saying that male sexual dysfunction can be treated by correcting deficiencies with the body, or getting the body back in balance?
Oh, absolutely. Yeah, absolutely. The vast majority of men who suffer from functional problems, like impotence, premature ejaculation, even fertility issues like low sperm count, lowered sperm motility, simply they don't have the building blocks present within the body to allow these areas to function properly. Often there are also more systemic problems that contribute to an issue. You have to remember that cardiovascular problems like blood pressure and flow and muscle tension, look, these are probably the most common complaints of Australian men. So let's not think it only encompasses the heart or the neck and shoulders for muscle complaints. the flow-on effects for these kind of issues with impotence and whatnot, of course it affects the whole body.
Very interesting. Actually, at Pure Health Direct, we also have a range of topical products that assist in that blood flow area too.
That's the Vimax range, isn't it?
Yeah, the maximum gel. Yeah, so.
That's right.
But it's time for another break, and we'll finish off our last segment shortly.